To see a patient that was so miserable and have this basically very simple outpatient procedure that has this balloon that has an elegant design and an elegant concept, and it works, and they no longer are struggling to urinate. They don't have this fear. They've read about the urethroplasty online and they're scared to death that's what they're going to be told they have to have, and then they have this other path and it's successful. They're happy with their urination, but it's also such a sense of relief, I think, for that patient that they've been able to avoid something so life-changing. There's no reason not to try an Optilume dilation first, and I stopped even saying try because that makes it sound like it's not going to work. And I told them that kind of my standard of care now is an Optilume balloon up front because it has the same chance of success as urethroplasty, but with almost no side effects.
The very first 24 hours, I felt a noticeable difference, and I was concerned a little bit that there might be some pain after the surgery, but to be honest with you, the entire experience within that first 24 hours was so much more comfortable, so much more easy. Right from the first day, I felt completely changed. The pain and the uncomfortable feeling that I've had for all those years had just gone away. I didn't feel any discomfort from the first time I urinated. Ever since then, it's just been a very fluid experience. In fact, when I had my first appointment to come back to do a follow-up, I was like, I don't know what we're gonna talk about because everything's great.
The biggest thing for me is that I am essentially 100% voiding. So, from everything we can tell, including a week ago, he checked my void, and and like he said, that's the ultimate test, really for him and for me. As long as I'm voiding and I'm able to go regular periods of time after drinking and whatever else, as far as not having to have these urges to get to the bathroom and so on and so forth, and feel confident that you can, you don't have to, be on standby every 2 seconds, that kind of thing. I said that's really what I'm more after, is just having a kind of normal lifestyle. If it's cutting edge and it increases my quality of life and lifestyle and the inconvenience of having to go to doctors and have procedures and whatever, I'm up for it. If the quality of life is being, compromised, by all means, I would jump on board. I don't see any issues with this at all. I really, really don't. That I've experienced or I've found. So yeah, I'd tell anybody to get it.
After a week, I felt pretty good. I've just passed a very positive uroflow test, and my PVR is low. So it's kind of no longer concerning. I'm kind of pushing it in the back of my mind. Quality of life has improved. I can garden, I can go out in my yard, do what I want. Before that, driving longer distances, traveling, attending sporting events, all those type of things were always kind of in my mind because, there was definitely some uncomfortable time there.